Rachel, good morning. How are you?
Good morning, Scott. Thank you so much for having me on your show.
All right, I do appreciate it. We are recording. This will be aired at a later date. Rachel, you have personal and professional experience fueling your passion for working with older adults and their families to help them age in place successfully. That's a very difficult decision to make and an awkward transition for a lot of people to move from where a place they've called home for so many years into a senior living. So for those who want to age in place successfully, I guess the biggest part is starting that conversation at the appropriate time.
Scott, you're absolutely right. This is something I've had to address in the last 25 plus years experience being an occupational therapist, but also with my own parents who are aging and they're in their 80s. Having the conversation is a challenge for the older adults or the caregivers, and it can be a difficult conversation, but it is one we must have because these discussions with our loved ones help us have a plan so that they can continue living and thriving in their home. It gives us peace of mind, and it gives a resource like our Safe Haven 360 plan.
Yeah, and and we'll get to more on that in a second. This impacts a lot of people, Rachel. More than 1 in 5 Americans are caregivers, having provided care to an adult. This total estimates 53 million adults in the United States. That's up from an estimated 43.5 million caregivers in 2015. So more and more people are having to deal with this with aging parents. So the more information we can get, we can save a lot of people a lot of money, and we can save people a lot of stress and make sure they make the right decisions. Because there are so many aspects. I can tell you, my parents, we had to move them from their home of 50 plus years into a retirement community, and those weren't easy conversations to have.
You're absolutely right. That is the recent stat from the AARP and even the Gates Foundation. 97% of older adults, want to age in place. And just like you and me, 90% of those are the adult children that want to help them. And this is it's stressful to navigate, and it's stressful to know what decisions to make. And we've created this safe haven so that we have a plan and the steps to take so that we can keep people at home, just like your mom and dad.
Yeah, okay. So, unfortunately, we were not able to keep them at home for too long because they just had they had cognitive issues that just really sped up the process.
Mm-hmm.
And that's another thing to look at. You don't know what's around the corner, medically speaking, so you have to be prepared, or this could be not only a truly stressful situation, but a financial, tragedy for a lot of people if decisions aren't in place.
You're absolutely right. And that is why with Well Assured and what we decided to do is go, look, it's a comprehensive audit, and it's built on 5 pillars, going way above and beyond just your fall prevention, right, and identifying tripping hazards. It does take areas of memory and cognition. We partner with home health care agencies nationally, Medicare reimbursement and Medicaid specialists and financial planners and estate lawyers, because it takes a variety of services for anyone to age in place successfully. And in this day and age, you do need a plan because life changes. And that's the beauty with our Safe Haven plan. Look, our audits are backed by registered nurses and OTs with over 25 years experience, and we're a team with you. And we build this plan knowing that we're looking at today, and we're looking at a year from now and 5 years from now. And you have RNs with you following up every month to see how the plan is going, what tweaks and changes need to be made so that it continues to evolve as you continue to evolve and age. Because lots of times it's not just black and white, right? A fall or a fracture. We could be dealing with neurological issues or progressive diseases with, rheumatology, rheumatoid arthritis, lymphoma, and others. And that's where our medical and clinical training and practice really comes into play.
Rachel Seltzer is a certified aging in place specialist. Another one, and another issue I came across with my parents was simply people wanting to be together. They've been together for so long, and if you're taken out of that house, there's a greater chance that you may be split up, say, at a retirement community due to medical situations. So staying together, another key aspect in this, comfort
Oh,
lifestyle.
absolutely. Yes, and the idea of being, look, we want everyone to be in a safe haven. Everyone does deserve, throughout our country, right? All 50 million adults. But it is routine. We are trying to preserve purpose and routine of our loved ones, because when you do have an issue with cognition and memory, as you spoke about with your parents, moving them to a new place and adjusting, that sometimes is very difficult, not only for them, but for us older adults, to witness and to see them go through, and it can cause more confusion. So our goal is
Yeah,
really to preserve just their everyday routine and their purpose, and keep families together.
yeah, because I think my father was able to deal with a little bit better, but there was such a noticeable change of just daily expressions, daily joy in my mother. They lived in that house for 50 plus years. They took a lot of their
Yeah,
furniture from that house to the retirement community, but it just wasn't the
not the
same. And
same. It's not the same. And I'll tell you something else, Scott, that's really important, that we, with our plan, we've done all the vetting. We have vetted all of our service providers, 100 plus in over 60 categories, taking the guesswork out, not only for the older adults, our loved ones, but for the adult child, that they can, going back, to sit down and have a productive conversation and know that their loved ones, mom and dad, are in good hands. They know exactly who to call, what resources, because we've done all that legwork. It's
yeah, and my
a
sister and
complex.
wife and I, after my parents moved in and they eventually passed away a few years ago, we were
Um,
like, we should have started that conversation a lot earlier. But I will say this: that conversation sometimes can be difficult to get started, or at least keep the momentum going, because when you get to a certain age, I discovered firsthand that you're not willing to change all that much, and take
no,
sometimes
you're not.
catastrophic incidences for those changes to happen.
If I can give advice, in all my years, one thing I learned about talking with our older adults is you have to be a team with them, and you have to respect the idea that this is their life, right? And to suddenly switch, like a role reversal, in that the adult child is in the parent role, won't be received well. So it's good to just sit down and, as a team, identify what the challenges are and say, hey, we want to work together. And we can get you into a safe haven and make these decisions together now proactively, versus waiting too long and really not knowing what your wishes are and what's important to you.
Yeah, and I'm glad you brought up the change of the role of the adult child, because my sister and I would always kind of compare to the role reversal. Like, the parents are the
Yes.
kids now. No, we're the responsible ones, and we're the ones chasing them around to make sure they don't fall or get hurt or don't eat what they're not supposed to. It's just a complete role reversal.
No, you're absolutely right, and that's what we forget is they still need to look. They're still living, and that
Yeah.
autonomy, and they want to be in control of the decisions that are made. So it's more of that team, and you're assisting them, and sometimes it's just education and acceptance, and just creating a safe place environment for that conversation, because they're
Yeah.
scared. Lots of times I realize they don't want to let their daughter or son know they just had a fall stepping in and out of the shower, because they don't want to lose their home. They don't want to be taken to an assisted living, or say they have difficulty, getting in and out of a car. And so that, they don't want to then suddenly their car being taken away, right, from their
Yeah.
children. So there's so many solutions and strategies out there, and that's really the approach we as adult children have to take. Like, hey, we want the same thing as you. We want to keep you here, and we want to make sure we give you peace of mind and us peace of mind. Let's
Yeah.
get a plan together.
Yeah, I never knew I had that much patience in me when just trying to get my dad to give up his car, his keys, because he really was not in the best position to be driving. But it was a you're taking this from my cold dead hands scenario. I mean, it's something that was his
Right.
freedom. You know.
And It was his freedom, and sometimes if the data doesn't support it, right? It's like if you go to a doctor and you take a test, like a stress test, and you fail that's concrete data. So you're like, okay, I gotta change my lifestyle. I gotta change my ways. Unfortunately, a lot of these things, when us adult children try and make those decisions, we need the data to support it. And part of our audit is a very comprehensive index and testing to show where we're falling, as far as thriving, as far as aging in place, what skills are you starting to decline on, whether it's cognition, whether it's, fine motor or defense mechanisms, even fine motor coordination and other things that we need for everyday tests. So it's there, and it's that then they can talk with a professional or clinical person like myself. So it's almost giving relief to the adult child, taking them out of the equation and showing them, hey, this is the issue. This is what we need to address together.
Having someone to talk to during these situations can go a long way. Rachel, I won't keep you any longer.
Absolutely.
Certified aging in place specialist. Rachel, where can people go to find this information? Because we have an aging population in North Carolina, and a lot of people are going to be dealing with this very subject here.
Oh, yes. We have an aging population throughout our country. So please go to safehavenforseniors.org. Wonderful website. And you can easily contact me. Our phone number and email is on there. Questions, anything I can help with. Our goal really is to bring people not only in North Carolina and where you are, but throughout our country into a safe haven. And thank you so much for having me, Scott.
Rachel, thank you, and thank you for helping us spread this vital information. I want people to not have to go through what my sister and I did, but hey, it all turned out well in the end for all of us. Rachel, thank you so much.
You're welcome. And a great Father's Day gift is a Safe Haven membership.
Oh, excellent. Yeah, well, I'll tag that with that as well. Thank you. That's perfect. And thank you very much for the information, and stay safe and stay cool. Have a good summer. Thank you.
You too. Thank you, Scott.
All righty. Bye-bye.
Bye.